Welcome to our Antimicrobial Stewardship Program, Prospective, Audit, and Feedback.
Lola Jones is a 77-year-old female that arrives to the emergency room complaining of lower back pain and swelling. She lives in a nursing home facility since 3 years ago and spends most of her time in bed watching TV. Also, she is a little overweight and stated not doing any type of exercise. Let's take her vitals and send her to Dr. Acevedo for a full physical examination. Dr. Acevedo, let's review Ms. Jones' vital signs to get a first impression. Her weight is 190 pounds. Her temperature is 100.1 degrees Fahrenheit. Her pulse is 95 beats per minute. And her respiratory rate is 22 breaths per minute.
After completing a thorough physical examination, we can see that Mrs. Jones has an ulcer in her sacral area. It shows redness and swelling. Also, it is secreting a brown-like pus, which should be collected for culture. This sacral ulcer could be a source of infection. Let's send her for a BMP, CBC, and LFT. Meanwhile, we should start her on empirical therapy with clindamycin.
In the record, I can see that Dr. Acevedo prescribed clindamycin 600 mg IV every 8 hours as an empiric therapy. Well, Ms. Feliciano already took the cultures from the ulcer and will send them to the lab. We have to wait for the culture results to know which litter bugs are hanging out there. Okay, we have our box list. Let's see which ones are there. Well, it seems that we have here some interesting bugs. MRSA and E. coli, what a team! I have to discuss these results with the doctor. By the way, I'm presenting myself. My name is Dr. Sotomayor. I'm in charge of the Antimicrobial Stewardship Program in this hospital. My responsibility is to make sure any patient receives the proper treatment based on culture results, costs, and patient-specific characteristics. Sometimes, doctors prescribe medication that do not cover those little bugs or prescribe medication extra expensive when we have other equally effective and more affordable options. It's important that every institution has a program like this one. That way, the pharmacist, who is the expert in medication, can work in conjunction with the doctor to make those clinical decisions together in benefit of the patient. Sadly, this is not the case in every institution. Hey, Dr. Garcia, I'm calling you to discuss the therapy of Ms. Jones. Dr. Acevedo prescribed clindamycin, but the culture results are ready. Did you have time to review the cultures?
I'm in a hurry now. I saw them very quickly. I sent to the pharmacy the prescription to continue clindamycin and start meropenem and sosing. That should work.
Well, based on the cultures, this patient needs MRSA coverage, so I recommend vancomycin 2 grams IV on a slow infusion every 12 hours and sosing 3.375 grams IV every 6 hours. That will cover both bugs and our patients can get better very soon. The meropenem and sosing will be a duplicate of therapy, and the patient may suffer from side effects.
Okay, Dr. Sotomayor. I think that's a great idea. I was helping on an emergency. I am sending you the new prescription. Thank you. Ms. Jones, I've noticed that your infection is getting better. In 2 more days, you can go comfortably to your nursing home again. I will order some physical therapy and a proper weight loss recommendation. Also, your nurse will help you with positions in bed. That will help you prevent future ulcers.
The role of the Antimicrobial Stewardship Program pharmacist in this intervention was to optimize therapy, reduce resistance risk, decrease costs for the patient, and maintain good communication with the physicians to give the proper treatment and assure the well-being of our patients.